Good afternoon. My name is Darcy Lee, and I am the Executive Director of Samaritans Southcoast, a suicide prevention agency that has supported Massachusetts residents for 42 years. I'm here today to strongly support House Bill 2221, which would require the 988 number to be printed on student IDs for grades 6 through 12 and IDs for college students. Samaritans Southcoast answers the 988 Suicide and Crisis Lifeline primarily for Bristol and Norfolk counties, while also providing backup coverage for Plymouth, Barnstable, Dukes, Nantucket, and Worcester counties. Our center answers the second highest number of 988 calls in Massachusetts, handling more than 18,000 988 calls last year and maintaining an answer rate 90% or higher. Our services include life-saving intervention by sending first responders to callers attempting suicide, as well as safety planning and coordinating warm transfers to mobile crisis intervention and the behavioral health helpline, facilitating a truly collaborative, community-based response for people in crisis. In our region, approximately 1,000 calls are made each year by young people aged 12 to 24. These are middle schoolers, high school students, and college-age youth struggling with anxiety, depression, bullying, family pressures, and overwhelming stress. Many simply don't know where to turn, or they feel too ashamed or afraid to reach out to someone they know. Adding 988 directly onto student IDs puts a lifeline into their hands, normalizing asking for help, removing barriers to support, and sending a powerful message that it's okay to reach out when they're hurting or in crisis. Whether it's the college student standing beside train tracks, the high schooler who ingested 25 prescription pills, or the 12-year-old child holding a knife to their skin, we were there to answer, to listen without judgment, and connect them to help. And yes, they are still here today. That is the life-saving impact of 988. Let's make 988 as instantly recognizable for young people experiencing a mental health or emotional crisis as 911 is for accidents or medical emergencies. Thank you for your commitment to safeguarding the well-being of our youth.
Thank you very much. Please, Madam Chair.
Thank you, Chair Velis. Thank you so much for your testimony. I'm wondering if you could share with us where young people currently are finding out about the hotline that's bringing them to your service, if you have a sense of how they access that information right now and how this legislation would expand that.
This legislation would greatly expand it because how they're finding out now is either by billboards along highways. Our Department of Public Health has provided a media rollout. There are signs on buses, at T-stops, and posters, as well as online. We also do a great deal of research, outreach in our region, in Bristol and Norfolk counties, reaching hundreds of young people at every school fair that we are at, and we ask them to sign anti-bully pledges with 988 on them so that they are aware that they can call 988 if they are feeling that they need any sort of help.
Thank you so much.
You're welcome.
Any other questions?
Mr. Chairman?
Please, yes.
Just wondering, and you may, just a personal question of follow-up. Do you get the information back? I know if I were the one on the phone, I'd want to know that that child was okay after all of this, and are there a lot of repeats in what you've seen?
We do get repeat callers. We don't necessarily receive information back. However, if someone is suicidal, we provide safety planning. And within our safety planning, they can receive a call back from our hotline. And the person who's calling is a trained crisis counselor, and they are calling to check on the person, and they receive 3 calls back.
Great, thank you. Thank you,
welcome.
Mr. Chairman.
I'm sorry, we have a roll.
We'll be back, sorry.
I'm sorry.
So a question I've been thinking to myself for multiple testifiers in a row on this is, what, in light of everything you've just said, right, talking about saving people's lives, so quite frankly, I don't even care about the answer to my own question, but what is the, why wouldn't we do this? I mean, yeah, help me understand, like, what is the, what's the, as stupid as I'm making it seem in my question, what am I missing here?
You're not missing anything. It's just change, right? So we're asking for this to be printed onto student IDs, so it's a slight change than what is normally done in printing student IDs with a picture, a name, the school, graduating year. So it's just simple printing it on IDs.
Thank you. Any other questions? And thank you for testifying today, and thank you for what you do in your day job. Really, really important, rewarding stuff. So we're grateful for you. Thank you very much.
All right, thank you for considering this.